hit it, pressurelicious.
Welcome back to my channel. If you're a new subscriber or a newcomer, welcome. My name is Uhebu Precious. I'm a YouTuber based in Berlin, and yeah, I talk about lifestyle, food, everything medical related. Yeah, and if you're an OG, welcome back to the channel. At the title, you already know we're going to be talking about how to level up our feminine hygiene, how to stay clean, how to take care of ourselves as ladies. Some of them you guys might be practicing it, some of them you've forgotten, so probably it's time to pick it back up. And if you're a young girl and you're quite confused on what to do and how to take care of yourself as a girl, please continue watching. Grab your popcorn and let's get right into the video. So yeah, as a girl, I know it's so stressful. We have a whole lot of things that we need to take care of in this body, and that's why I'm here. First of all, we're going to be talking about oral hygiene. I'm not just going to bore you guys. You guys already know, brush your teeth, once, twice a day. It depends on what you're suffering. And if you've noticed that you have bad breath, and this one is, there are bad breaths that you have. There are bad breaths that you have when you wake up in the morning. That's different. There are bad breaths you have when you eat something that is not, nice. That's different. But when you've constantly brushed your teeth, you've used mouthwash, you've used everything, you've flossed, and you still have mouth odor, please go and see a dentist or see a professional that can tell you what's wrong with you. Probably you have something with oral cavity, something. It might also be from inside. You'd never know. Always take care of your mouth, okay? If you want to use mouthwash, you can use mouthwash. But for mouthwash, personally, I go for washes that has a pH of less than 5. If it has a pH that is not less than 5. If it's less than 5, please guys, don't buy a specific brand of mouthwash that personally I would not recommend to anybody. Is Listerine. Listerine has less than 5% of the pH is less than 5%, and it states there that it kills 99% of bacteria, including good bacteria, when you know that you need good bacteria too in your mouth. Okay, so I know that there are good brands out there like TheraBreath, so many, but I know that TheraBreath is one recommended mouthwash that dentists and gum surgeons talk about most of the time. And there's another one, Coradil. I don't know, I'll put it out there. But most of these mouthwashes are not the regular ones you would see in the store and buy. Some of them are recommended by a gum surgeon or a dentist or someone, and there are specific times to take them. So I would recommend for mouthwash, always ask your dentist or something, or someone that, okay, you want to start taking this, or okay, you have sensitive gum, you're just prone to some kind of things. Before you use anything, just ask your dentist so that he can give you the one that specifically would work for what you have. Is our hair, as a girl, cornrows. Personally, almost of the time I'm always on cornrows, because I really don't have time to braid my hair. I personally go on cornrows, just cornrows. So I make sure that I wash my cornrows. I wash my hair at least 3 or once a week. I won't advise once a week because our hair texture is different from the other people, our colleagues. So I won't advise to be washing your hair every week, but at least twice in, like, every 2 weeks, just wash your hair. Every 2 weeks, wash your hair. That's just all. Let's go to our body, our skin. Your skin is the largest part. So imagine the largest organ in your body, and you're not taking care of it. What do you think is going to happen to your own skin, to your internal organs? So guys, I always advise, make sure, I don't know, these days, organic, bioorganic, inorganic, everybody now is selling body cream. Everybody now is doing bleaching cream. Everybody now is doing, I don't know what everybody's doing now, but I'm not here to spoil anybody's market. All I'm saying, as to the consumers that are going to consume these goods, please make sure that what you're buying, make sure, because I know I have seen like a whole lot of things. Before you use anything, at least see a dermatologist. It's your skin you're talking about. You just don't go to, because someone came out with, oh, I made a cream that works like this and this, and you just use it. I know everybody just wants to, look good, give off that my skin is popping, or this is that, this. Sometimes you might be having that skin infection or that thing because of what you take. Whatever you take is what's going to come out of your body. Sometimes it's not even the product, it might be what you consume, and that's why it's always good to watch what you eat. Like, take water, eat healthy, eat right. Then if it's not from what you eat, then it might be a hormonal change or something. Go and see a dermatologist, go to the doctor, run some tests. Don't just go to because you've seen, I'm selling this for this. Personally, I've tried it and it not work. I'm not saying it might not work. It might work for you. I don't know, but I'm just here trying to tell you guys that there are safer ways to take care of your skin without going through all those bleaching. And besides, I know I've heard of people that bleach and everything and use creams that end up giving them body odor. It is there, it happens. So if you know that you want to be doing all those things and you want, please go to a dermatologist. They can recommend a good cream for you, good moisturizing cream, good body oils, everything that can work for what you want to do, or you want to, but I will not recommend whitening and bleaching. The next you're going to be talking about our underarm. You can wax, you can shave. It all depends, whatever you want. Personally, I would lean towards waxing, just because waxing, it takes time before your hair goes back, and it leaves your hair less coarse and thick. So I would recommend wax. After waxing, cleaning and everything, you can use deodorants. Guys, deodorants are different from antiperspirants. Deodorants are the ones that would cover up your body odor or anything. We are not covering no body odor. If you have body odor, please go and treat it. All I'm saying is so that you smell nice down there. While antiperspirants are the ones that tries to stop perspiration or sweat. It doesn't block the vessels, like it doesn't block your glands totally, but it tries to stop it. So if you sweat a lot, if you sweat a lot, just lean towards antiperspirants, whereas to deodorant. I'm going to be talking about our private parts, and this is one thing that studies have shown that 45% of ladies do not know what their private part looks like, which is weird because I just think everybody should know their private part, know how it looks like, what it looks like. The advice: if you can stand in front of the mirror, look at your vagina, your private parts. Look at your groin area, look at your pubic area, look at your vulva, look at everything. So you know that if something is wrong, you will know where, like, you know what to say. You look at your private part and say, this thing was not here before, what is wrong? All those things. Just be familiar with your skin, with your body, and all those things, so that when something is wrong, you would know, you can tell that something is wrong with you. People tend to call that part vagina. Everything is not your vagina. Your vagina is a thing, is an opening that you can't see when you look out. Like when you stand to look at your vagina, you cannot see your vagina. The thing you can see is your vulva. Vulva is different from your vagina. Vulva is the outer part of your vagina. Okay, so you can see that one, and the vagina is one. Vagina is an opening. It doesn't open all the time. It opens when, okay, something is entering in, that's a penis or whatever you guys use to enter inside, or when it's opening when you want to give birth, and all about our groin area, our pubic hairs. Waxing, shaving, anyone you feel best, but personally I would recommend waxing. Wax your area because of the reasons I mentioned before. Let's talk to the familiar question, the frequent questions people ask. Should you wash your vulva? Should you wash your vagina? How should you wash your vagina? You should do this one. Guys, first off, you don't wash your vagina. Your vagina is inside. You cannot wash your vagina. Your vagina cleanses itself. All those discharge, except it's like a smelly discharge, or like, that something is wrong with you. But all those discharges that come out, those are the vaginal way of cleaning itself. So you don't need to be bothered about whether your vagina is clean or something. If you are clean, if you don't have any infection, or you're not itching or anything, and your pH is normal, it's expected that you would have discharge, and those discharges are not bad. It depends on the time you have them. Do not bother yourself on whether my vagina is clean or not. Okay, that should not be your problem. So long as you're healthy, you've checked, like you've gone to a gynecologist, and you don't have any complaint or any sort of itching or anything, then you don't have to think of whether your vagina is neat. Okay, just eat right, take probiotics like in supplements or in food. Personally, I lean towards food like Greek yogurt, soy milk, sourdough bread, all those things that would replace supplements. So I really don't take probiotics and supplements, not like that. But if you want to, that's fine for you, and make sure it is recommended by your doctor. Should you wash your vagina? No, you should not wash your vagina. Should you wash your vulva? Yes, you should wash your vulva. Yeah, you should wash your vulva with water, and not just water, with soap, but not scented soaps. So here's the thing. I know that people have been saying, yeah, wash your vagina with your vulva with water, just water. Let's be realistic. If you think about it, can you wash if your vulva or your private part has sebaceous glands that produce, sweat, that remove things, okay? So let's think about it. If you're washing it with water, how it's just like saying you want to shower and you just want to shower with water. How does your skin look or feel afterwards? It's not going to make sense. So personally, I would advise you can use soap, but not scented soaps. That's why I'm giving you the difference between your vagina and your vulva. Your vulva is just the outer part, and that's where you're supposed to wash. The inner lip, the outer lip, that's where you're supposed to wash, not your vagina. Okay? You use water and soap, you wash it, you wash your vagina, After washing, you pat dry, and then you use a moisturizer. To some people, you can use a moisturizer. That's if you have like skin infections like psoriasis or all these eczema and all those things. And yes, you can use a moisturizer to like moisturize down there after patting dry. Do not rub, just pat dry with a clean towel. But if your skin is normal, like you don't have anything, just pat dry and leave it to air. I would also recommend pap smears, to always go for a pap smear. Once you're 21, go for a pap smear, and after that you can wait 3 years after, because some doctors will tell you if your pap smear is normal, your stuff is normal, they tell you to wait for 3 years to do another one. Just frequently just check yourself out to make sure that your vagina is free from precancerous cells and all those stuff. Okay, you can also do cervical screening just to know that your cervix is not abnormal. There are not things there, there are no growths and anything that would give, that would just check. If you have an infection, please go to the hospital. Please go and see a doctor. I am so particular about my private parts because I have spent a lot of money just taking care of it. I think on a very special day, I'm going to give that story, okay? But personally, I will not. If you know that you're itching, or you've noticed a discharge that is not as normal as your normal discharge, please go and see a gynecologist. It's not going to cost you anything. It's better you treat it that time than keeping it and using nonsense inside your vagina. Okay, I've seen so many things on the internet. Put garlic, put cloves. So like, I don't know. Before you even take any drug, go and see a gynecologist, because guess what? This is what it does. If you keep taking drugs and you don't know what you're fighting, you don't know what your body is producing and like what is actually wrong with you, and you keep taking any kind of drug that you see, guess what? When it's time to now for the drug, maybe you've gone to the hospital and then they give you the particular drug that is supposed to cure what is wrong with you. You'll not start having resistance to that drug because your body is so used to taking so many antibiotics, so many things, that when it's time now to fight, to start fighting against those drugs, it will be resisting the drugs, the effect of the drugs on your body. If you're taking these things now, your pH 2 is going to be disbalanced. thereby you breed infection for bacterial vaginosis and thrush and all those kind of things. So please, before you use anything, just go to the gynecologist, tell them this is what is wrong with me, I want to treat this, I want to do a pap smear, I want to do a cervical. If pap smear, if you've not done it, please ensure you do it so that you avoid any risk of cervical cancer. Guys, it is real. It is really real. For my ladies that are sexually active, yeah, and you've now taken care of so that it's not be like you've cleaned yourself, you know that you're free, and then you suddenly now have this infection. Abstain from sex for a while. Treat yourself and treat your partner, which is why it's also good to have one partner, so that the disease, you will know where you need to focus your attention on. Okay, when you notice that you have an infection, go to the hospital. Preferably you can go with your guy, your partner, whoever. Tell them that, let's go to the hospital for screening, just to check ourselves. It's not, even though you don't have any infection, once in a while it's good to go with your partner to check yourself, because guess what, he might even be infected and you don't know about it. He might be infected and he doesn't even know about it, because why? Our urethra is different from theirs is longer than ours. Okay, so that's why we tend to get more like infections, because by the time the infection or the bacteria goes up, it's going to take time. Before then, they might have taken something that will just flush it down. They really don't feel that symptoms. They don't have that symptoms as to us. That is so early, we can notice it with like any slightest thing. Okay, so if you know that you have, just go with your partner. Or if you now say, okay, your partner doesn't want to go with you, when you get to the hospital, tell them that you're sexually active. That's why they ask this question. Some people just think they're asking just to be nosy. No, some doctors really need to know, okay, you are sexually active because it might be an STD infection, it might be anything, just to be safe. Okay, so that after treating it too, you can also treat your partner and your partner doesn't give it back to you. So this is what happens when you treat your vagina. Now you've treated everything, your infection, and then you now go back to your partner. Okay, you guys now start having sex again. Guess what? There are still some strains of that bacteria that you were trying to treat in him, which he might not know. It's not his fault. He might not know. So now you now put it back. You now have sex and then you put it back into your vagina again. Infestation. It starts to breed again. That's what happens. So a doctor will ask you if you're sexually active, so that they can give a drugs or even treat your partner first. Treat both of you before you can continue to do whatever you want to do. And okay, you still don't want this thing. You say you want to use condom. You say you don't want to abstain from sex, and you still want to do thing. You can use condom, but then just know that condom will not save you from all the types of STDs. It will not save you from every type of STDs, because there are some STDs that are not even like gotten by by sex, by contacts, just like HPV, herpes. All those ones are gotten from contacts. Okay, and the of them all is that HPV, because there are so many types. Really, there are so many types. They have the high risk, the low risk. There are so many types. So just be careful, stay safe. Go to the there are HPV vaccines. Make sure you take. You have to always keep updating your vaccine game. Make sure that your vaccines are up to date. You take everything. Okay, go to the hospital. Okay, check yourself. Check everything. That if something is wrong with you, know your body for yourself. Okay, and yeah, I think I've touched on so many things. I've tried, and I'm very sensitive about this private part thing, because I've had my own share of experience, and I think I'm going to talk about that in another video. Probably, maybe. Okay, if you want me to talk about the video, about what happened to me, comments in the comment section. Leave a comment, I'll talk about it. Alright guys, thank you guys for watching. If there are also other tips that you also would want to share, please leave it in the comments. Everybody would learn. I would also learn from it, guys. So yeah, thank you so much, and see you guys in my next video. Bye. Wait, have you subscribed? Why are you not subscribing? Why? You see this fine babe, don't you want to be seeing me on your screen every day? Why don't you want to be seeing me on your screen every day? Please subscribe, please like and share. Okay, thank you guys.